Physiological Functioning, Part 1. A frail old man went to live with his son, daughter-in-law, and 4-year-old grandson. The old man's hands trembled, and his eyesight was blurred, and his step faltered. The family ate together at the table, but the elderly grandfather's shaky hands and failing sight made eating difficult. Peas rolled off his spoon onto the floor. When he grasped the glass, milk spilled on the tablecloth. The son and daughter-in-law became irritated with the mess. "We must do something about grandfather," said the son. "I've had enough of his spilled milk, noisy eating, and food on the floor." So the husband and wife set a small table in the corner. There, grandfather ate alone while the rest of the family enjoyed dinner. Since grandfather had broken a dish or two, his food was served in a wooden bowl. When the family glanced in grandfather's direction, sometimes he had a tear in his eye as he sat alone. Still, the only words the couple had for him were sharp admonitions when he dropped a fork or spilled food. The 4-year-old watched it all in silence. One evening before supper, the father noticed his son playing with wood scraps on the floor. He asked the child sweetly, "What are you making?" Just as sweetly, the boy responded, "Oh, I am making a little bowl for you and Mama to eat your food when I grow up." The 4-year-old smiled and went back to work. The words so struck the parents that they were speechless. Then tears started to stream down their cheeks. Though no word was spoken, both knew what must be done. That evening, the husband took grandfather's hand and gently led him back to the family table. For the remainder of his days, he ate every meal with the family. And for some reason, neither the husband or wife seemed to care any longer when a fork was dropped, milk spilled, or the tablecloth soiled. Author unknown. Does aging happen to everyone? For example, gray hair, wrinkled skin, blindness, memory loss, incontinence. Many of the physical changes of aging will affect a person's appearance. Some of the more noticeable effects begin to appear after the 4th decade of life. It's then that men may experience hair loss, and both sexes may develop gray hair and wrinkles. As body fat atrophies, the body's contours will gain a bony appearance, along with a deepening of the hollows of the intercostal and supraclavicular spaces, orbits, and axilla. Stature will decrease, resulting in a loss of approximately 2 inches in height by 80 years of age. Body shrinkage is due to reduced hydration, loss of cartilage, and thinning of the vertebrae. The decrease in stature causes the long bones of the body, which do not shrink, to appear disproportionately long. Any curvature of the spine, hips, and knees may be present and can further reduce height. These changes in physical appearance are gradual and subtle. Changes occur due to both genetic and environmental factors. Physiological changes of the skin and integumentary system would be a loss of pigment in the hair and skin, wrinkling of the skin, thinning of the epidermis, decrease in skin turgor and elasticity. Elongated ears, a double chin, and baggy eyelids are among the more obvious signs of the loss of tissue elasticity. Skin fold thickness is significantly reduced in the forearm and on the backs of the hands. Increased nail thickness and decreased nail growth. Decreased perspiration. Dry, itchy, and scaly skin. Seborrheic dermatitis and keratosis formation. With the epidermis, it thins with age, making blood vessels and bruises appear more visible. Reactivation of latent conditions such as herpes zosters or shingles or herpes simplex. Cell renewal increases by up to 1/3, causing slowed wound healing. In other words, it can take up to 30 days or more for new epithelial cells to develop. Inflammatory process is delayed, and you may not see initial erythematosus for 48 to 72 hours after a scrape or a cut, etc. This is crucial to remember when assessing for signs of infection because erythema may not show up until a few days later, but still, the increasing redness and purulent drainage will be the key to infection. And looking at the dermis, the skin will become more transparent and fragile. You have reduced dermal blood vessels, accounting for skin pallor and cooler temperature of the skin. As collagen production decreases, so does the give of skin, causing it to tear more easily under a reduced amount of stress. And elastic fibers thicken and fragment, causing a sagging appearance. With the hypodermis, we look at the subcutaneous layer. There's a decreased fat that causes increased sensitivity to the cold. They are at an increased chance of hyperthermia due to reduced efficiency of sweat glands, due to the glands becoming more fibrotic and surrounding connective tissue becoming more avascular. And sebaceous glands that secrete the oil, they begin to atrophy, increasing the risk of vitamin D deficiency. Hair. Men and women in all racial groups will have less hair as they grow older. The head hair thins. They may have hair in the ears, nose, and eyebrows in the males that will increase and begins to get stiffer. Leg, axillary, and pubic hair will lessen and may disappear in postmenopausal women. Older women begin to develop chin hair. Pigmentation in the hair is lost. The distinctive traits of various racial groups need to be kept in mind in caring for and assessing the person, as this can affect what is seen. Nails begin to harden and become thicker. They're more brittle, dull, and opaque. You may see vertical ridges appear. They have a slower growth, and the shape changes from convex to flat or concave. Those vertical ridges appear, and the half moon of the fingernail may entirely disappear. Color may vary from yellow to gray, and the growth of nails slows, making treating fungal infections more difficult. Nursing considerations: you have to be very careful when removing tape from elderly skin, and make sure that you provide appropriate warmth and routine nail care. Nursing actions: be sure to encourage avoidance of excessive exposure to ultraviolet light. Keep the skin moisturized. Avoid the use of drying soaps, and encourage the use of sunscreens, and encourage them to be well hydrated. The top nail on the left-hand side is brittle. The bottom on the left-hand side show the ridges, and on the right-hand side it shows the concavity of the nail. Physiological changes in the musculoskeletal system include muscle mass and strength decreasing and atrophying of muscles. They will have a decreased mobility, range of motion, flexibility, coordination, and stability. Their gait can change, and they have a shortened step and a wider base. Their posture and stature will change, and this can cause a decrease in height, increased brittleness of bones, joint capsule component deterioration, kyphosis of the dorsal spine. None of these changes are life-threatening, however, they can affect one's ability to function and therefore affect one's quality of life. Different diseases we look at are osteoporosis, which is a loss of bone density. This reduces risks, or we need to reduce risks and injuries by increasing weight-bearing exercises, improving nutrition, encourage smoking cessation, medications, support shoes, use of a step stool, decreasing clutter, and eliminating throw rugs. Arthritis is another disease, and it's the most common cause of disability in America. It is more common in women, with an increased incidence after age 45. It includes osteoarthritis, which is the most common type of arthritis. The symptoms can be worse in the morning. There might be bone spurs that cause deformity, stiffness, pain, and impaired function. Risk factors would include age, obesity, family history, and repetitive use or trauma to a joint. So those of you that like to run are more apt to develop arthritis in older age because of the repetitive use and trauma to your joints. Polymyalgia rheumatica is a common inflammatory disease, but does not include joint inflammation. With this one, pain is worse at night and early in the morning, and it develops in the neck, upper arms, and evolves to the pelvis and pectoral girdles. Rheumatoid arthritis is a chronic autoimmune systemic inflammatory joint disease that affects more women than men. It shows itself with pain and swelling in the smaller joints such as the wrist, knee, ankle, and hand. You also see fatigue, malaise, and unexplained fevers. And gout is an inflammatory arthritis where uric acid crystals accumulate in the joints. The joints can become bright purple-red, very hot to touch, and very painful. Some risk factors will include alcohol abuse, hypertension, a diet that is high in purine, and medications. The ligaments, tendons, and joints all become drier, hardened, more rigid, and less flexible over time. Joints that are subjected to trauma earlier in life will usually show these changes earlier and in more severe form. Muscle mass will decrease, and 30 to 40% of muscle mass of a 30-year-old may be lost by the time a person reaches their 90s. Disuse of the muscles can accelerate this loss of strength. While muscle mass decreases, the adipose tissue will increase in key areas. In males, we see it in the waist, and in females between the umbilicus and the symphysis pubis. Posture changes are a result of the intervertebral discs that dehydrate. Sorry about that. We have to encourage exercise, especially those weight-bearing exercises, to help maintain healthy bones and muscles. Muscle strength diminishes in proportion to the decline in muscle mass. Again, osteoporosis is a major health threat for 44 million Americans. Of this, 10 million already have osteoporosis, and the other 34 million have low bone mass. Postmenopausal women experience a greater rate of bone demineralization, and they need to increase and maintain their calcium intake to assist in decreasing risk of fractures. These changes will place the older adult at greater risk for fractures, kyphosis, back pain, joint pain, loss of strength, flexibility, and endurance. Nursing considerations provide assistance as needed for ambulation, position changes, ADLs, and encourage independence. Nursing actions ensure a regular intake of vitamin D and calcium, engage in regular weight-bearing exercises, for example, Tai Chi, engage in regular flexibility and balance exercises, for example, yoga. For women, consider preventive pharmacotherapeutics for prevention of loss of some of the bone and joint. Provide for safety with assistive devices and assistance as necessary, and realize that all of the changes that occur in the musculoskeletal system have the potential to affect one's self-esteem. This is a change in the musculoskeletal system through aging. Physiological changes in the respiratory system include a decreased stretch and compliance of the chest wall. We also see a decreased strength and function of the respiratory muscles and size and number of alveoli. So as a result, we see an increased rate of respirations, generally 16 to 25 breaths per minute, and this is considered normal in the older adult. We see a decreased depth of respirations and oxygen intake, along with a decreased ability to cough and expectorate sputum. Chest recoil is lost, and the chest wall begins to stiffen. The biggest change is in the efficiency of the gas exchange with resistance to airflow. Respiratory problems are common, but usually are caused by environmental factors. Some of the diseases we see of the respiratory system include the chronic obstructive pulmonary disease, or COPD, which is the third leading cause of death in the elderly. It results from chronic asthma, bronchitis, and emphysema. It can be caused by tobacco use, exposure to pollutants, genetics, and allergens. The lungs become unable to exhale all of the inspired air, and it becomes trapped in the alveoli, and then the victim begins to develop that barrel chest. Pneumonia is a bacterial or lower respiratory tract infection that causes lung inflammation. Along with influenza, pneumonia is the seventh leading cause of death in clients over the age 65. And tuberculosis. This is the most deadly communicable bacterial infection. Symptoms will include unexplained weight loss, fever, a cough that lasts over 3 weeks, night sweats, anxiety. And in the more advanced disease, you see dyspnea, chest pain, and hemoptysis. We see tuberculosis a lot in the third world countries, those people that live in close proximity to others, and age can increase the risk. Nursing considerations: you have to be careful where you place infectious clients to prevent contamination of other clients. And clients' decreased respiratory function can affect other aspects of the client's life. Nursing actions will include encouraging the pneumonia immunization and the annual influenza immunization, providing teaching and education regarding exposure to smoke and pollutants, discouraging smoking and providing smoking cessation education, avoiding persons with respiratory illnesses, encourage clients to seek prompt treatment of respiratory infections, provide and teach infection control, such as washing hands frequently, provide additional time for meals in relaxed atmosphere for those who have chronic respiratory issues, practice thorough, regular oral hygiene with the goal of being an increased level of independence, increased exercise tolerance, and decreased hospitalizations. Physiological changes in the cardiovascular system include diminished energy and endurance with a lowered tolerance to exercise, decreased compliance of the heart muscle. Heart valves will become thicker and more rigid. You see a decreased cardiac output and efficiency of blood return to the heart with a decreased resting heart rate. So it's going to take longer for the heart to accelerate and then to return to normal. We see weak peripheral pulses, excuse me, and increased blood pressure, but these clients are susceptible to postural hypotension. Heart disease is the #1 cause of non-accidental death worldwide. The blood vessels become stiff, stretched, and blood supply to various organs such as the liver and kidneys decreases and peripheral resistance increase. Cardiovascular diseases that we see are hypertension, which is the most chronic cardiovascular disease of older adults. Diagnosis of hypertension is based on 3 separate readings. Blood pressure does increase slightly with age. The goal is to have the blood pressure at 120/60. Coronary heart disease is the next disease, and this involves a stiffening of the blood vessels that causes inadequate blood flow. Causes can include smoke exposure, pollutants, and genetics. And heart failure. This is a disease of the heart muscle that causes muscle damage, and the heart is no longer able to pump effectively. Symptoms will include fatigue, shortness of air, weight gain, lower extremity edema, and dyspnea. Myocardial infarction, angina are the other 2. Nursing considerations include diminished cardiac function that can affect multiple systems. So if you have a decreased cardiovascular function, you can expect other systems such as the kidneys and the liver and the lungs, etc., to be affected. Nursing actions encourage regular exercise, a low-fat, low-cholesterol, balanced diet, and tight control of diabetes if that's an issue. Discourage smoking and exposure to smoke. Encourage avoidance of environmental pollutants. Provide stress management exercises and education. And encourage minimizing sodium intake and ideal body weight. Physiological changes in renal and genitourinary include a decreased kidney size, decreased kidney function, and the ability to concentrate urine. Decreased glomerular filtration rate and capacity of the bladder, with an increased residual urine, increased incidence of infection, and incontinence. We might also see impaired medication excretion. Remember that the majority of medications are excreted through the kidneys, and if the kidneys are no longer functioning, then medications are not being excreted appropriately. Blood flow can decrease approximately 10% per decade to the kidneys. And these changes are significant due to the resultant heightened susceptibility to fluid and electrolyte imbalance and structural damage. Considerations include childbirth and or aging process can result in urinary incontinence. And incontinence can affect the confidence and self-esteem of a person. Nursing actions: make sure you encourage hydration. Teach Kegel exercises to improve incontinence issues. Provide hygiene. And teach signs and symptoms of infection and aging renal bladder issues.